Your urine could be revealing a serious problem long before you feel sick. Most people flush, walk away, and never think about it again. But changes in color, smell, form, frequency, or appearance may be your body's first warning sign of a disease that can quietly damage your kidneys, heart, nerves, and blood vessels for years before symptoms appear. And one urine change that many people ignore is often discovered just before a diagnosis. Stay with me because the most dangerous warning sign appears later in this video. Why you should care? Many diseases hide silently. You can feel completely normal while damage is already happening inside your body. One of the most common diseases that urine often warns about is diabetes. In fact, some people notice urine changes months or even years before they realize something is wrong. Today, you will learn the urine warning signs that could point diabetes, why they happen, who is most at risk, and what you should do if you notice them. Let's begin with the sign doctors hear about most often. Sign number 1, urinating more often than usual. If you are suddenly making more trips to the bathroom, especially without drinking more fluids, your body may be trying to tell you something. When blood sugar becomes too high, the kidneys work harder to remove excess glucose from the bloodstream. To do that, they pull more water into the urine. The result, more urine, more bathroom visits, and often more dehydration. Some people notice they need to urinate every hour. Others find themselves planning their day around restroom access. People often blame aging, stress, or drinking too much water, but sometimes the real cause is elevated blood sugar, and the next sign often appear at the same time. Sign number 2, waking up repeatedly to urinate at night. Many people think waking up at night is normal, but waking 2, 3, or even 4 times regularly can sometimes be a warning sign. High blood sugar doesn't stop when you go to sleep. Your kidneys continue trying to remove excess glucose throughout the night. That means continued urine production over time. Poor sleep can leave you exhausted, irritable, and less available to control blood sugar levels. The cycles becomes worse. People over 40, those who are overweight, and people with a family history of diabetes should pay particular attention. But the next warning sign can be even more noticeable. Warning sign number 3, excess thirst after urinating. Have you ever felt like no matter how much water you drink, you are still thirsty? This can happen because frequent urination removes large amount of fluid from the body. As dehydration develops, the brain triggers stronger thirst signal. Many people start carrying water everywhere. They drink constantly, yet the thirst keep returning. This combination, frequent urination plus excessive thirst, is one of the classic warning signs doctors look for when evaluating diabetes. But here is where things become more interesting. The next urine changes surprises many people. Sign number 4, sweet smelling or fruity smelling urine. Urine normally has mild odor, but when blood sugar levels become very high, some people notice a sweet or fruity smell. Why? Because excess glucose can spill into the urine. In severe cases, the body may begin producing substances called ketones, which can create a fruity odor. This isn't something everyone notices, but when it happens, it deserves attention, especially if it's combined with increased thirst, fatigue, or frequent urination. And now we come to warning sign that many people mistake for something harmless. Warning sign number 5, foamy urine that doesn't go away. Most people see bubbles in the toilet occasionally. That's usually normal. But persistent foamy urine can be different. Foamy urine may indicate protein leaking into the urine. Healthy kidneys normally keep protein in the bloodstream. When kidneys filters become damaged, protein can escape. Diabetes is one of the leading causes of this kind of kidney damage. This is why doctors often test urine for protein when screening for diabetic kidney disease. And what comes next is often ignored because people assume it's unrelated. Warning sign number 6, dark yellow urine despite drinking water. Urine color can change for many reasons, but persistent dark urine may signal dehydration. Remember what happens when blood sugar is high. The body loses more water through urination. Even if you are drinking fluids, dehydration can sometimes continue. You may also experience dry mouth, dry skin, headache, fatigue, dizziness. Many people treat these symptoms separately, but together they may be part of a larger picture. And the next symptoms often appears before diagnosis. Warning sign number 7, frequent urinary tract infections. Here is something many people don't realize. High blood sugar can create an environment where bacteria grow more easily. As a result, urinary tract infections may occur more often. Warning signs can include burning sensation during urination, cloudy urine, strong smelling urine, pelvic discomfort, increased urgency. Women are particularly vulnerable, but men can experience this too. Recurring infections should never be ignored because they may be pointing towards an underlying blood sugar problem. But the next warning sign is one of the most overlooked. Warning sign number 8, cloudy urine. Healthy urine is usually clear. Cloudy urine may occur for many reasons, including infections, dehydration, or excess substances being filtered by the kidney. When combined with other symptoms we've discussed, it may warrant further evaluation. The important thing is not to panic. The urine change alone doesn't automatically mean diabetes, but multiple changes occurring together should get your attention. And now for the sign that often surprises people most. Warning sign number 9. You feel completely fine. This may sound strange, but one of the most dangerous aspects of diabetes is that many people feel normal during the early stages. There may be no pain, no obvious illness, no dramatic warning, just subtle urine changes. That is why diabetes is sometimes called a silent disease. Damage can slowly affect the kidneys, eyes, nerves, heart, blood vessels, long before symptoms become severe. And that's exactly why paying attention to urine changes can be so valuable. Who is most at risk? Your risk may be higher if you are overweight, if you have a family history of diabetes, if you are physically inactive, if you have high blood pressure, if you have high cholesterol, if you are over 45, if you previously had gestational diabetes, if you've had prediabetes. Even younger adults can develop diabetes, so age alone doesn't provide protection. What should you do if you notice these signs? First, don't assume the worst. Many urine changes have harmless explanations, but don't ignore persistent changes either. Consider scheduling a medical checkup, asking for a blood sugar test, monitoring how often you urinate, stay hydrated, maintaining a healthy weight, exercising regularly, reducing excess sugary drinks. Early detection can prevent serious complications, and often the earlier diabetes is found, the easier it is to manage. Your urine may seem unimportant, but sometimes it reveals health problems long before symptoms appear. The key is noticing patterns, not isolated events. Frequent urination, excessive thirst, sweet-smelling urine, foamy urine, recurring infections, and persistent urine changes may all deserve attention. Your body often sends warning signals long before serious disease develop. The people who notice them early often have the best outcome. If you found this helpful, subscribe for more hidden warning signs your body may be revealing.